unable to attend and to assist us to get minutes. They don't go anywhere else. So, and also please don't share anywhere else. Okay, so well, firstly, I come to you from Yagara. Oh, I'm getting feedback. What's happening there? No, it's okay now. I come to you from Yagara and Turrbal land here in Brisbane North, and I'd like to acknowledge the traditional owners and pay my respects to elders past, present, and emerging in this beautiful country and countries we are lucky to live on. If I could just ask that each of you just pop into the chat, if you wouldn't mind, your name, which PHN or where you're from, that would be excellent. And somehow we'll work out, one of us will be clever and work out how we can put on our name on the screen how to add which PHN so we know where we're from. And I'm just saying welcome. I'm just doing the acknowledgements and morning, Karina and Carolyn. How are you? I think you're on mute.
Hi, Paula. It's Karina. I've got Caitlin O'Brien here.
Oh, hi. I do look like I get a lot of people popping in because I was sitting in Kaz's office for a while. I get a lot of people calling me Kaz, so don't worry about it.
Oh, good. I could have called you my, friend's name. I get names mixed up, so
yeah, completely fine.
Okay. All righty. Hey, Michelle. Michelle's just joined us from Gold Coast. How you going? Okie doke. So I'd also, before we kick off, pay my respects to those of us here today that have a lived experience, either themselves or as a family or carer member, and also to the MHLEEN network in general for being just such tremendous allies for working towards embedding lived experience in all that we do and promoting and developing the peer workforce. And most importantly to the how we share and information, resources and programs that are happening around the place, which is it's a critical reason why we came together in the first place. So just in terms of the agenda, so we've done our outcome. We've just got apologies from Healthy North Queensland, Healthy North Coast, North Queensland, Southeast Melbourne, and I think Southwest Sydney and Country SA. And if they were tentative, so if you are there, just say g'day. And just for noting, we have been in touch with Healthy North Coast that has been very much impacted by the floods down there. We've linked in with our lead members that are based down there and, having conversations about what and if any support we, may be able to lend. I think one of our lead members is keen to share I guess some of the experiences that people are going through down there, and particularly in relation to, service providers and the impact it's had on the peer workers, even, down in that space. So I'm sure I can safely say on behalf of us all that we're all thinking of and, supporting and hoping all the best for Healthy North Queensland, Amy and team. So so then we'll just quickly go through actions. Then we'll invite the department. Has Caitlin joined us, Karina? Do you know? Oh, that's gosh, you just said that, didn't you? Okay, so we've got off to a good start here. So we've got Caitlin from the department, so I'll get her to introduce herself shortly. Then we'll take a break at about the hour mark, and because we're so jammed for time, but how awesome it is to hear about any news or updates that's going on in your space or in your state. If you could just pop those into the chat, and then after the break we can just invite you to speak to that. you know, some of that stuff's really, really important, you know, for all of our learnings and ideas, you know, for moving forward. And then, so major focus today, as you'd be aware, is the upcoming forum. So we've set a date, and Maddie and those on the working group, I'll invite you to bring the broader MHLEEN up to date in terms of some of the key discussions and decisions that have been made. And I'm hoping Kerry Hawkins will be joining us from the National Mental Health Consumer Carer Forum, and we'll just give you a bit of an update on the 3 leadership projects. So again, I'll invite those of you that are sitting on some of those project steering groups, if you have any updates in relation to that, that would be great to hear. And that'll take us probably easily through to our 2 hours. So, Maddie, could you just kick off? Sorry, I don't know if I asked you to do this or but just any key actions from our last meeting, just for noting.
Yep, let's have a look at what we put down last time.
The major stuff was just around getting the
yeah, so it was to get I had some forum consultation questions.
Yeah.
And expression of interest for the forum working group. So that obviously went out, and we've since had a couple of meetings with the forum working group. So that action item is completed.
Yep.
Then we were going to send out like the list of calendar events. Paula, right. I think you've put that template together, which includes the information around the Louise Byrne webinars that we've been
and the other stuff.
The other things have coming up, so I don't know.
I haven't sent that. Yeah,
still.
I'm naughty. I haven't sent that out yet, but I will. So that's yeah, just all of the, you know, our meeting dates, lead meeting dates, and all of the capacity building initiatives, including the partnership leadership stuff. So that will come out with the minutes.
Yeah, so there's an action, Carrie, to provide an update at the next MHLEEN meeting, and I can see Carrie's here.
Carrie's here. Yep. And then Karina to work with the team and facilitate consultation. So we've been Karina and our secretariat. We've had a few conversations, and yeah, we've been in touch, and I'm happy to say that I want to break the news, Karina. I was going to let the department do it, but so we do have written confirmation that we will continue for at least another 12 months. So that's pretty good news all round. All righty, so that's actions.
Paula, just the other action was the community of practice.
Yes.
Lauren Key. So is that just going to stay open for the time being? Okay.
And that's my fault. And I will, again, own
No,
it.
that's my fault,
Lauren.
Paula.
No, Lauren, because you've reached out and I haven't followed up. So totally own it. But yeah, we will get that started. I think we all need it at the moment. Just and for those of you, we were just talking about having an informal kind of community of practice, just to talk, you know, share and debrief, and, you know, because it's important that we do that. It's, you know, pretty challenging, the work that we're doing within PHNs, and so, you know, part of it, our network, is to support each other. So thanks for that, Maddie. All righty. So what I might do is invite Caitlin and Karina from the department just to provide us with any updates that are relevant to us. So welcome. Thank you.
Thank you, Paula. As you've heard, everyone, the Department of Health has approved a continuation of funding. So we're just working through the procurement steps in terms of extending the current contract we have with Brisbane North. So there'll be 12 more months of funding to continue the secretariat work for this network. And we're very pleased, just as much as you are, Paula, to be able to do that. I have an update for the network on, I'm just getting my talking points up, on the national agreement. We have, on the 11th of March this year, National Cabinet noted that the national agreement had come into effect. And the national agreement has now been signed by the Commonwealth, New South Wales, Queensland, South Australia, Tasmania, Northern Territory, and the ACT Treasurers.
That must have been the Anastasia Palaszczuk alert I just had, that she was making an announcement before. Sorry, keep going.
The national agreement was developed through the Health National Cabinet Reform Committee and negotiated by a mental health senior officials group comprising officials with responsibility for mental health policy from Commonwealth and state and territory governments. The national agreement is a first step in delivering system-wide reform across Australia's mental health and suicide prevention system, with the aim of delivering a comprehensive, coordinated, compassionate and consumer-focused system. It incorporates key recommendations from the Productivity Commission report into mental health and the final advice from the National Suicide Prevention Advisor. The national agreement also sets out the shared intention of the Commonwealth and states and territories to work in partnership to improve the mental health of all Australians while ensuring the sustainability and enhancing mental health and suicide prevention services. It sets out clear roles, responsibilities and accountabilities for the funding and delivery of mental health and suicide prevention services across the entire mental health and suicide prevention system. It includes national objectives, outcomes and outputs for mental health and suicide prevention to focus on outcomes that matter to people, improve safety, quality and capacity in the system, and improve accountability. The agreement includes joint Commonwealth and state and territory priority areas such as working to address gaps in the system of care, improving mental health services available to adults, children and youth, expanding the availability of suicide prevention services, increasing system integration through strengthened regional planning and commissioning, improving data collection, sharing and evaluation, and expanding and enhancing the availability of a skilled workforce, including the peer workforce. I've just got a bit of an update on the bilateral schedules. Bilateral schedules have been finalised with New South Wales, South Australia, the Northern Territory and the ACT, and negotiations are well underway with ministers and senior officials from the remaining states and territories. Bilateral schedules set out individual initiatives as well as funding commitments with the states and territories. The next step for the Commonwealth and state governments will be to work towards implementing commitments in the national agreement, which will be overseen by senior officials, with health ministers and mental health ministers retaining responsibility for achieving outcomes. The national agreement commits to embed the views of people with lived experience of mental ill health and suicide and their families and carers throughout implementation of the agreement. The Australian Government recognises this is important to achieving a mental health and suicide prevention system that is person-centred and consumer-focused. Yeah, that is my update from the team here in Health who looks after the national agreement. So I know they've been working many nights and weekends in the lead up to getting things as far as it has gotten. So yeah. I've got Caitlin here who's joined me. She's from the Mental Health Workforce Implementation section and can provide more of an update on peer worker initiatives.
Yeah. So as Karina was saying, I'm Caitlin O'Brien. I'm the director of the Mental Health Workforce Implementation team. There are two teams for mental health workforce here at Health. There's a policy team, which Cindy Toms she leads that team, and then I lead implementation, which just means that anything that is in previous budgets, it's my job to make sure that gets off the ground. The big thing that we've been focused on in your space in particular over the last couple of weeks has been the peer worker scholarships that were announced as part of last year's budget. So for those who aren't aware, there was 2.575 million announced for 390 peer worker scholarships nationally for those who were studying a Cert 4 in mental health peer work. We've done a lot of kind of early work thinking about what's the best approach to administer these scholarships. And through kind of conversations that often were kind of led on from national agreement discussions, we realised that there was a lot of work being done in jurisdictions in this space, including some scholarships that already exist for peer workers. And so from there, we worked with the National Mental Health Commission to reach out to state mental health commissions, who now we have had pretty extensive discussions with, and all jurisdictions have agreed that they will deliver those scholarships on behalf of the Commonwealth. So rather than us taking a national approach, getting a provider that might not know the nuance in each state and territory, we're going to give the money to the states and territories, and they're going to look at how it will best fit with their particular jurisdiction. There are a couple of things that kind of are quite central to that, and one of it is that there's a requirement for 5% of those scholarships to be given to Aboriginal and Torres Strait Islander students. There's an expectation that priority be given to those in rural and remote areas. And something that we've also pushed with those scholarships is that there's a real priority given to those who are outside of the state or Commonwealth sector. We want to make sure that those who are kind of less likely to be able to afford to do a Cert 4 or to have their organisation pay to do a Cert 4 get first access to those scholarships. So where that's up to is really like the last couple of weeks have really been nutting out whether the state can do that. A couple of jurisdictions are very practiced at scholarships and are very active in the peer worker space. Some of them the opposite. And so we've been working to kind of make sure that they understand what the ask is. Now where we're up to is the Commonwealth has gone out and formally asked for them to quote and asked them to look at contracts and things like that. But we probably are going to come up against caretaker in terms of getting that executed. So what we're planning on doing is using the caretaker period to really kind of talk through with the states how this is going to operate. The expectation still is that that will commence this financial year. So they're all aware that that's our expectation, with the idea that scholarships be made available first semester next year. So that's kind of where we're up to. We're really happy with where we've landed with this state and territory approach. And I think where it's been really helpful has been understanding the work that might not be so visible that the states are doing. So from those discussions, we really do understand the focus of different jurisdictions. And that kind of leads me a little bit into some of the measures that were announced as part of the budget yesterday. Most of this sits in Cindy's patch, so I can kind of talk at a very high level, but one of the main parts of the workforce elements of the budget was the idea of a distribution mechanism. And the idea is that the Commonwealth and the states and territories set up a formal mechanism where we work together on ensuring that the mental health workforce is looked at kind of nationally. And so we don't have a very different approach to, say, peer workers in New South Wales than we do in Victoria, in Tasmania, whatever. The whole philosophy of this mechanism is that there is one mental health workforce. It's not that you completely exist in one system for your entire career and you never move. So we want to make sure that what we're looking at is how we can really look at our investment in the round and better target different groups based on where that need is. A particular focus of that group is likely to be peer workers. And this scholarship program is a good way for us to kind of embed that really. We'll set up a group for those who are going to be delivering the scholarships to discuss what are challenges or things that have really worked in that space. And that's a way that they can really look at how that's working. The distribution of the scholarships is purely based on enrolments. So we've worked with the Department of Employment of, oh God, I'm going to get it wrong every time, Education, Skills and Employment. So we've worked with them to get enrolments for Cert 4 peer workers by state. And that's how we've split the scholarships rather than going kind of the traditional way where we just split based on what the usual population base is and things like that. And that's just to make sure that really the demand and uptake is going to be pretty balanced. We don't want to be, giving heaps and heaps and heaps to one jurisdiction that might not have many people enrolled. So we want to make sure we're giving that money, and that money is going out to peer workers, and it doesn't matter what state they're in. So that's really where we're up to on it. If you guys are happy, I'll continue to give you some updates at these meetings just on where they're up to. And I can kind of feedback from some of those governance meetings where we can kind of talk about where that stuff is up to.
Yeah. So Caitlin, thanks for that. So we put a submission into the draft National Mental Health Workforce Development Strategy. I'm not aware. Has that document been finalised? I don't recall seeing anything.
It hasn't been publicly released yet. The draft strategy is with government.
Sorry?
The draft strategy is with government, so it hasn't been released yet. Yeah.
Okay. No idea on when that might.
No, we really aren't. The idea was that we wanted it up just in time for budget in case they wanted to release it alongside that, but that hasn't happened and we haven't really had any word from that. So that was the timeline we were working to, but I think from here it's kind of a decision for them.
Okay.
Yeah.
So, I think it's great that you've gone down this path of working at the state territory level and not just giving it to a national group to throw it out there. And that's based on past experience. So that's great news. Just quickly, I'd be interested to hear if anyone here, like different states and territories, and what they know is happening in their own state and territories with those scholarships. So I'll kick off. So in Queensland, the money's gone to the Queensland Mental Health Commission. We have now that we've got a Queensland Lived Experience Workforce Network that's just become incorporated, and we're working with the peak Community Mental Health Service peak body, QAMH. We're having discussions with the Commission around some of the, very known issues of it's not just a matter of putting out an EOI and signing people up, and the importance of having that wraparound support, identifying workplaces that are going to provide meaningful experience, quality from the, quality of delivery from the RTO and those sorts of things. So that's kind of where we're at in Queensland. I'm almost glad to hear that the caretaker is going to delay actually what you're saying, the actual implementation, because that's
the contracting, I suppose, is the best way to do it.
Yeah.
So the money changing hands, really.
Yeah. So that actually will, for those of you that are kind of play in that space, an opportunity to work with your commission or whoever to have the discussion about the issues of the access and quality of that Cert 4. Does anybody else, like anyone from New South Wales? I've know bits and pieces, but
there is just one thing I will add is that for those jurisdictions who don't have like a commission in terms of like an operating body or have commissioners, we have worked with those commissions to see whether they're comfortable, and in most cases it's the commissioners working in partnership with the Department of Health. So they'll use that particular department to deliver it. So we've always gone through the commissioners, except for, I think, the ACT and TAS. But with those, we have kind of always gone through the commissions, and they've given us the advice to go in a different direction. So for some jurisdictions, the health department's doing it, but the commission is basically the advisor. I think the thing that we will say is that we are leaving it very open to each of the jurisdictions in where they want to target those peer worker scholarships. So for Victoria, they know that what they've currently got in terms of free TAFE is really helpful if you don't have a particular accreditation. But if you have an accreditation already, you are likely not eligible for free TAFE. And so they can use the scholarship to focus on those who want to retrain as a peer worker rather than those who don't have any qualifications at all to lead up to. So they're kind of going to focus where there are currently gaps and where they know there are financial issues. We are also speaking to them about how they might be able to use any funds that are left over to do those supporting wraparound services, and what that looks like is going to be different in each jurisdiction based on what they have already. And we are leaving it up to them to kind of make a decision as to how that will work. But again, the focus is really getting the funding to the people who actually really want to undertake this work and to overcome that barrier. I think I provided it in the notes last time, but these scholarships have up to $4,000 for course fees and $1,000 as a stipend. And that's to pay for anything that kind of sits outside of course fees. So that might be kind of supporting materials if they need to travel to get to kind of training or placements or anything like that. There is that $1,000 that is kind of specific, which is quite rare in terms of government scholarships. So that is something that's a bit different. But what that means in terms of the course fees is if you know the course fees are only going to be $1,000, then you potentially have $3,000 unspent that you can use for different services. So we are kind of talking to each of the jurisdictions about that.
Is it possible to share the criteria that you've
what I might do is
or dot point notes or something?
I can give you some dot point notes for
That's
sure.
it.
I think we can do eligibility, but I think in terms of how they'll be delivered, we won't really know that answer for sure until we get proposals back from the states and territories, because it might be slightly different. They might want to really target a certain group, but I'm happy to give you some high level dot points on criteria for that.
Some of our PHNs in the past have actually actively offered scholarships to undertake the Cert 4. So, there's quite a few PHNs that play in that space and can be very useful at that local level. So just going back to other states and territories, Lauren's put in the comments if Caitlin, would you mind having a separate conversation with Caitlin from Northern Territory?
Yeah, that's fine.
Yeah, that's fine. Cool. Alrighty. Anyone else know what's happening in their state and territory in relation to these scholarships? No. I'll just throw out. Oh, hang on, I've got hands up. Who hang on, Maddie, can you monitor hands? Because I always, Alex, was it Alex?
Yeah.
Oh, yeah. Hey, Alex, your hand's up. Alex, you there? WA? Hello? Oh, hang on, something's happening. So Alex from WA, we'll wait till you're on mute, Alex. So you there?
Yeah.
Yeah, okay.
Sorry, I should say they probably haven't reached out yet because we don't have those contractual things in place. They've been waiting for us. To be honest, that is probably a bit of our problem. We've been holding off on offering these a bit until bilaterals were kind of in a bit of a stronger state.
Right.
So if they haven't reached out, I would say that's more our bad, to be fair.
Yeah. So
with Paula, sorry, that was in relation to Adelaide PHN. Wills has just asked has commented that Adelaide PHN has not heard anything from the Mental Health Commission there in South Australia. So Caitlin was just reading the chat and responded to that. And then Alex has written to us.
Yeah. Can you hear us now, Alex? I'm not on mute, but it appears you can't hear me. Yes, so we can't hear you. So I don't know what to say other than please use chat, and we'll keep an eye on it.
I'm happy if Karina sends through my details, and Alex, you can get in touch with me directly if you've got a question.
Yeah. My understanding with New South Wales, it might and I think Tim's just joined us. He may know further in terms of the scholarships. The Mental Health Coordinating Council, I think, is playing a role in New South Wales. I'm not sure of any other state and territories, so I'm not sure we'll do. We're working. Okay, so Alex has said from WA, we're working with WA Mental Health Commission around locations. Great. Thanks, Alex.
And the scholarships are with the New South Wales Commission.
Oh, thanks, Tim. Did everyone hear that? You're a little bit soft, Tim. Soft voice. Use your outside voice, Tim.
Yeah, no, sorry, it's the technology, I think. I might come in on my iPad. Can you hear me if I yell like this? Or is it
outside voice.
Right, okay. That's my playground voice, Paula.
Yes. You have permission to yell. So you were saying that the money's gone to the New South Wales Commission.
Yeah, I'm not sure. I'm not over the top of all the details, but yeah, so the 90 or 80 or 90 scholarships have gone to the commission, and they will then work out. We're working out how to get them out. Yeah.
And Tim, you've come in a bit late. We've just Caitlin was talking about the National Mental Health Workforce Strategy, so that actually hasn't been finalised yet. But that's Anyway, alrighty. Well, look, hey, thanks heaps for that update. Yeah. Good. Well, look, it's good to know what's happening. And again, I do appreciate. Yeah, I think it's a great decision to work with state and territories on, the rollout of these scholarships. And I encourage all of our members here to get in the loop around what's happening in their region. Okie dokie. So. Maybe just the other couple of things, and this probably maybe I'll move to Carrie from the National Commission. So, Caitlin, you also have the consumer and/or carer peak under your work area, and the lived experience workforce networky money, but that was in the budget.
So I mean, Carrie will be able to speak to this, but we fund the commission to undertake that work. Yeah.
Okay, that's a lovely segue
Yes.
Carrie. Welcome, Carrie, from the Commission, Director of Lived Experience.
Hi, Paula. Hi, everyone. So in terms of an update, which is not an update on anything we talked about last month, but I think that's a good thing, because we understand just how important these two projects are. So the co-design of the National Lived Experience Peer Workforce Professional Network, and then also, as you said, the co-design for a national peak or peaks. And so we've been really, really carefully thinking about the approach. We've had draft project plans. They've gone in for review, and we've continued to refine those, because we know.
What's just happened?
Sorry, Paula. Oh.
Yep, you still don't go.
Yeah, sorry, I thought I heard someone. And so that revision, I think we finally finessed it now enough that it is, both of those are now sitting with both project plans with the executive for review and sign off. And we'll certainly update you as soon as possible. Obviously, we're going into caretaker as well. And so, and I'm sure Caitlin's keen for an update. So you've just got one, Caitlin. So I would say that that's imminent, like the sign off of those, and then obviously caretaker. But we're going to use that opportunity to really be developing a good, stakeholder engagement and communications plan, and further work on, really getting a good quality process to set this up for success, particularly the consumer carer peak. We know that long history, many of you would know, and some of you have been right in the thick of being involved in that. So just ensuring that the process, generates a model and advice to government that can really translate into an effective and sustainable model for both the peak and of course the network as well. So
I encourage hands up for any comments. You know me, I've always got something to say. In conversations, I can't even remember which committee or which meeting, but we were having discussions about these two initiatives, and firstly, the importance of recognising, that it's not starting from a blank slate, that there has been a lot of work done in the past for both, but secondly, with the network stuff, the role of that national lived experience workforce, we're really keen to be involved in those discussions, because there's a few of our PHNs that have been quite proactive in establishing lived experience networks within their own region, and or working with their state peak bodies and those sorts of things. The other point I'd like to make is, getting, who needs to be involved in that stakeholder engagement. And I would be, I think I can safely say that MHLEEN and LEAD would like to be very proactively involved. And it might be something separate to you might have a, all of stakeholder kind of thing, but we'd be more than happy to pull our lead team together, to have some concrete discussions around implementation side of this. Yeah. Does anybody else have any comments on sort of national peak for consumers and or carers, or the National Lived Experience Workforce Network?
Well, just obviously good to see you, Carrie, and it's important that history, I suppose. Obviously the stuff that sits with Mental Health Australia around all the work that Leanne Craze did with the Consumer Reference Group, and when Mark Butler was there, and I think the work we did in getting up the National Peak Alliance, which is still operational despite funding. I think the will of the consumer group to have a dedicated, peak body is palpable, and is there historically. I think there's stuff if obviously you'd have most of that stuff, but if there's any way we can, the peak people like like Bing or Leland or Comwa or Vimiak, if they, I think they're the vital people to talk to as part of that alliance. Yeah,
absolutely. I think they're the more visible, obvious and visible people, like stakeholders, but I think certainly wanting to hear, and this is a way of feeding this into that stakeholder engagement, sort of that development of that plan. Who else should be? I mean, it's interesting, Tim. I don't think I'm as up to date as I would be in terms of where the alliance is as well, in terms of so that would be really good for you to directly feedback where that's up to, like as of today, what's been happening. And then also definitely wanting to hear from people here around who else might be less in sort of visible to the Commission around who needs to be consulted, who needs to be in the room, the co-design room of both of these. There's obviously significant overlap, but there's some unique, there'd be some unique stakeholders and groups that need to be consulted, collaborated with. So really happy to hear just in people's initial thoughts here, and that could be feedback. But Tim, certainly if we can have a direct kind of conversation.
Yeah, for sure. Like I think a lot of the alliance is symbolic, but there's practical examples of, say, Irene Gallagher at the Select Committee for Mental Health and Suicide Prevention, where she spoke strongly on behalf of the alliance. That's on record there. But a lot of the work, because they're not resourced, it's been very difficult on an ongoing way, I think. But Ellie Hodges down in South Australia, I think, is good.
Yeah, absolutely.
Yeah. So we can work on as an action item just some suggestions for key stakeholders. And I think this again, if you look at the role of PHNs and locally, they're commissioning services to try, to some of those priority groups, and and our MHLEEN members actively trying to ensure that there's engagement and that sort of stuff. We're not perfect, but PHNs can be quite resourceful for getting some of those linkages, Carrie. So yeah, so keen to support those two pieces of work, and really glad the position you're in as well in the commission. So we really want to have lots of working together opportunities like we do with the National Mental Health Consumer Carer Forum. And
Yeah,
I think I saw Kerry pop up somewhere there. Kerry, are you online? Kerry Hawkins?
she was.
She was.
I'm sure.
Oh, okay. No worries. Lauren's got a hand up. Thanks, Maddie.
Thank you. I'm just wondering if that kind of national network is something that our states who don't have a consumer peak can tap into, given the membership, I guess, would be different. Does that make sense?
Yep. Queensland was in the same position. I mean, we've got a consumer peak, but it's not operational. So we've been, So I understand what you're saying there, Lauren.
Because we don't have a combined kind of a voice. There's very little happening in the space. If there are bits and pieces happening, they're not coming together, and so I've kind of been playing a strange role in trying to bring the different bits and pieces together to try and channel those voices and those people in somewhere. But it's pretty difficult.
Yeah.
I think, Lauren, it's I think one of the features of the co-design process for that national peak or peaks is around understanding the sort of the mechanisms for how a national peak will interact with other, like, state and even regional, like you're saying, Paula, existing bodies, organisations. That's something I think is for the co-design process. Certainly.
Yeah. And I guess too, there's also some, work being done with the Commission and a working group looking at a lived experience participation summit at some stage. And part of that process is identifying key stakeholders to get involved in that as well. So, okay, thanks heaps for that update, Carrie. And some important work being done, and if you're not in it, I don't know what the saying is. Sorry, but we want to be part of assisting shaping what that might look like. Vicky from Black Dog Institute, how are you, Vicky? You wanted to give us an update around the Aboriginal Torres Strait Islander Lived Experience Engagement Centre in at Black Dog?
Well, all I really wanted to do, hello everyone.
Hey.
Thanks for the opportunity, Paula. I just really wanted to share some very important news. Some of you might have heard it already, but our executive team leader for the Aboriginal and Torres Strait Islander Lived Experience Centre, Leilani Dowan, has resigned formally today.
Yep.
So we're in the process of seeing how seeing the next steps forward in terms of having her replaced, and what some of those challenges will be for us, but also some of those wonderful opportunities that will come also. So it's sort of bittersweet, nothing more bitter than it.
Oh, well.
Anything else.
Yeah.
Because the centre has been her dream. She's put more than 100% of her love and her passion and everything into developing the centre and ensuring that the right processes has been in place for us to be able to be where we are today. So I just wanted to share that bit of info. Otherwise, we're doing really well. Well, as well as can be expected.
Yeah. In these times, hey, Vicky. And yeah, I have had some contact with Leilani, but I think we will, if it's okay, we'll formally write to Leilani thanking her, because she actually was involved as one of the founding members very early on in the piece and has been amazing to be able, been able to fit in time to support the work of MHLEEN over the years. But we're lucky we've got Vicky now too, and same goes to you, Vicky. It's an important partnership and relationship. So yeah. So thank you for that update. Okay. I'm just thinking. I think we're almost doing well on time for a change. So I guess the MHLEEN Secretariat update. Look, we'll probably cover most of the activities down after the break, but as you know, that with the launch of the national, I'll talk capacity building outside of stuff that we've got with the National Consumer Care Forum. So again, and we are fortunate to have Dr. Louise Burns, who has been very actively, supporting the work of MHLEEN and agreed to work with us over a period of time to take, for us to understand the national guidelines. So we're running a series of webinars at the moment, and she's tailoring it for different cohorts. So we've offered it to our lead members first off, but that was just before the end of last year. We've had a few sessions for PHN specifically, and now we're moving into commission services. Look, it's a hit. It's booked out. We've got a waiting list. So we're talking to Lou about running a few more. We're going to record and have that available. So that'll be a tool for, our MHLEEN members, to share internally within our MOHOD teams, along with commission services. The agreement also, it's not about just running a, here's what it is thing, but we're working also on the next step of and it's nothing set in concrete. We may leave it for another day, but it'll be probably on the agenda at our annual forum as well. But working on some sort of strategy to move into more of the conversations around the implementation. So having, like people like Lou and key service providers that already do have peer workers, and bringing together, commission services that don't. But here comes Kerry now. Don't, but having some forums around the actual implementation of these guidelines, and what and how this could be done, learning from others and those sorts of things. So pretty excited about that one, and it's one of our core objectives.
Paula, can I just quickly ask, are we able to get some learning outcomes for the training? Because I've had a request to know specifically what those learning outcomes might be.
Right. Okay. I thought the flyer kind of covered what the purpose of it, but
they wanted more specific details.
More specific. No worries. We can take a look at that.
Thanks, Paula.
Yeah, but I guess off the top of my head, the learning outcomes is to increase awareness and awareness of and understanding of the new national guidelines. And then the purpose is to build capacity of PHNs and commission services to look towards implementing. That's just off the top of my head, but you got to start somewhere. We got to know what's it's it's a lot of information. And Lou's presenting the way she presents, it's really helpful as a starting point before you sit down with the big manual and go through. She's also going to develop for us a bit of a PHNized like guide. So something that's can be specific to PHN. So that's going to be an important tool for us as well. But thank you for that, Wilhelmina. Other things going on. So, oh yes, so Tim's going to be doing a MHLEEN presentation at the upcoming Equally Well Symposium in April on behalf of us all. So thank you, Tim, for doing that. And he's also a keynote address at the Equally Well. So that's really great too. And you were what was the keynote? It was around lived experience workforce. Is that right, Tim?
Yeah. So we have the sort of PHN talk, which I'm doing, is on embedding lived experience engagement within PHNs, and then a keynote which is should be fun, and that's really on. It's titled "The Lived Experience Workforce Being Equally Well." So it's looking at like there's ways of interpreting that being equally well in terms of the physical and mental health parity that we want for people with who live with mental health issues. But I think I can also finesse it a little bit around how equally well is the peer workforce in comparison to other workforces. I'm thinking that way anyway. I haven't done things yet, but it's time to stir it up a little bit, perhaps. But we'll yeah, hopefully it's worthwhile. You will have all perhaps seen the Equally Well guidelines, etc., that came out recently.
Yeah. So thanks heaps for doing that, Tim.
Yeah, all right.
Kerry, I think I saw you, Kerry Hawkins. Are you out there? Kerry.
Yes, I am. Sorry.
Oh, there she is. She keeps popping in and out. Kerry, after the break, we'll talk. We'll provide a bit of an update around the leadership projects. But just to let you know, so Kerry and I, as co-chairs of the leadership projects, are having, now that we know that we'll be funded for another year, are having conversations around, and sorry, Kerry, I put you on the spot, but it's just more just flagging some of the things that we've been having a chat about doing moving forward. So some of the stuff that's come out of the webinars with, for the national guidelines and lived experience is carer peer workers, and there needing to be some more done in that space. So that's just flagging that as a gap and a priority area that's been emerging from our engagement. Also, we're looking at the Yale program, the Let's Lead transformational leadership programs going great. Great group of people. We're getting access to some great resources and those sorts of things. And our thinking is looking at offering another round potentially, but the focus is for carers as opposed to consumers, because anyway, it's just at thinking stage. Hey, Kerry, but we've sort of planning forward and building on some of the projects that we're working on. We'll talk more about the specific projects that are underway now after the break. How can we access the recordings of the Liam? Yes, we're just we'll be getting those. Okay, I'll tell the truth. I've just got to get, because we're doing Zoom, and I'm needing some help to get it into a YouTube format. So we've got a few versions too. So we're waiting, probably going to pick one or two that are targeted, for people lived experience and one for the service system. We'll pop them in the meantime up on the MHLEEN website on My Mental Health. And that we're also maybe just keep an eye out on that MHLEEN website too, because we've been loading up some resources and some videos of presentations that we've done and those sorts of things onto that site. Yes, okay. So I'll stop rambling now. It's 11:30. We're on time. So we're now going to have a break. So can I please ask that during the break, first and most importantly, as we're talking about physical health, make sure you get up and have a stretch and whatever you need to do. But then secondly, please, if you've got anything that you'd like to share after the break, any updates, any news, any, questions, it's just opportunity to we'll pop them into the chat, then we'll go through that once we get back from the break. So let's aim for, it's 11:30 here in Vegas. So whatever time it is in everyone's state and territory, 10 minutes starting from now. Okay, see you in a bit. I'm just trying to do some updates so I don't talk anymore. Date offer. Did I? Ah, there we go. I've done some updates. Got 2 minutes. How's everyone? Hey, Lauren, we got to catch up one of these days, love.
Yeah, hopefully soon. I have a big. I'm pitching to our leadership team next week. The scaffold of a capability, lived experience capability framework for the organisation.
Okay. What day is that on?
It's on Wednesday next week.
All right. You want to catch?
What's the date?
Yeah.
Yeah, it's been interesting. I've searched far and wide for the organisational capability kind of frameworks and stuff, and I haven't found any. But yeah, working in the silo. And guess what? Bella's leaving.
Oh no, where's she going?
I think she's at that phase of her life where she doesn't want to spend her last working days in the stress of mental health.
I get that.
The sector. I mean, she's been doing it for a long time.
Yeah. I actually love, but like awesome people like Bella and, like when they do make that call and, but have been such great contributors to, the movement, but to let it go and,
Yeah.
if you can.
The timing's okay. I've had enough time to kind of
Yeah.
build a tiny bit of confidence, but yeah, it's a big blow really in terms of allies.
Yeah. All right. Well, hey, let's make some time next week before Wednesday. I'm just having a look. Monday afternoon, you got any time?
Perfect. I'll have a look right now.
Just send something through and we'll do that. We've got a lot of catching up to do. All righty, it's 11:40 on the dot. So, geez, I'm doing really well with chairing today and keeping us on time. I'm just having a look. Has anybody got anything in the updates? Yep, so webinar, Linda's slightly longer, Alex has had to leave. I've just chucked in a few things in the chat around, like if anyone's asking you about MHLEEN and, I find this useful rather than having to write a heap of stuff is the link there of that's sort of publicly available. So if anyone's, asking for any information about MHLEEN, that's there. Just from Brisbane North, really excited that it's our 6-year anniversary for our peer participation in mental health services, which is pretty cool. And we presented at the Queensland Parliamentary Inquiry into Mental Health, which was an experience. And our other exciting news is that like Tim was saying earlier about the Alliance, the Peak Alliance, Queensland Lived Experience Workforce Network has been totally voluntary. We've been chipping away at it for years, but we've got to the point we've become incorporated. We've got a good solid partnership now with the Queensland Alliance, and we've actually got some project funding to do a little bit of work. So Tim, if anyone has any good peer work physical health programs, I'd love to hear from you. Okay, so if anyone off the top of their head got anything in mind, I'll have to have a think because my brain can't think that quickly. Off the top of my head, Tim, I know the NEMI program that I think some other PHNs fund their optimal health program in the low intensity space is one good example. It's
Yeah.
run by peers. I've actually done the program myself, and it was, oh geez, yeah, it really draws your attention to that whole of self-care and well-being. So I think that's a pretty good one. That's the only one I could think off the top of my head, but the coaching stuff too.
Yeah.
You know, yeah, that might be another one. Yeah.
Great.
Yeah.
Yeah, no, a lot of people are doing stuff, and it's yeah, really important to get it out there. So if anybody does have anything, the conference is only on in about 12 days or so, I think. So
Right.
if
Yeah.
you find anything to get it across quickly.
To Tim, yep. And we'll send you. We've got a number of MHLEEN presentations, and then we've also, with the peer work, we'll send you through the Louise Burns PowerPoint
Yeah, no,
stuff.
that'll be
Yep.
good. It's pretty
Great.
short notice, but it only came my way last Friday.
Yeah.
Sort of like I feel we fill the gap, sort of. So
Hey. I don't know. Getting a keynote's not too bad. Guy's saying he's got some stuff.
yeah.
Oh, what Lauren's saying? What's the question again? Tim, what was the question again?
Well, it's equally well as looking at the physical health needs and you know, bringing that gap in lifespan to an more equal one. So we're dying 30 years too early, and so it's any programs that peer workers are driving in terms of improving people's, or you know, not improving. We don't do it to people, but allowing people to improve their own physical health would be great. Just I'm just starting on the slides and stuff.
Yeah. The intent of the lived experience recovery coaches would fit into that, I'd imagine too.
Yeah.
Yeah. And who's this one? Lauren's developed a recovery Lauren. So Lauren's developed a recovery education program for the Northern Territory. So it might be good to catch up with Lauren on that one. Kerry. Now, Kerry Hawker, how can we measure them according to things that matter to people with a lived experience?
Yeah, look, that's really important. You know, I think in this context, we had a forum the other day with Equally Well, and you know, people are pounding on people to, you know, the smoking cessation especially, you know, and I just reflected, you know, people with really difficult so-called, you know, conditions, often cigarettes might be the only thing that they enjoy or that centers them, that's really part of their life. And so they're spending, and I went with a person the other day to get 2 small pouches of tobacco, and it cost him $120 for 2 tiny little pouches. And so he's not eating well, you know, people aren't eating well. And so it's a wicked problem, isn't it, if we use that term about what we should be doing around improving people's lifespan, but improving people's quality of life as well. So all the medication issues come into it as well.
Oh yeah.
And I think it's really interesting to me. When I first came in, peer workers weren't allowed to talk about medication to people. But you know, what happens if your lived experience is that you've had experience of tapering off medication and have had really good outcomes? Are you allowed to use that? Like, I think that it's an interesting topic.
Oh, definitely. For those of you that I've been in contact with the last couple of weeks, I've been withdrawing from Valium, and it's been horrendous. I'm quite openly happy to share it because I know the impact of, you know, long-term use of Valium and physical health, and, you know, mixed with having chronic pain and taking pain medications and all of that. Yeah, so I'm living the dream with that stuff and the medication stuff. Maybe I'm wondering if there's any in the AOD space, any programs that we're commissioning that look at sort of like addiction and stuff as well, Tim. Yep. So Guy, oh hang on, it's just changed. Guy, you had an update? from Brisbane South?
Yeah, hi everyone. If it's of interest, I mentioned it to you, I think it was last week or the week before, Paula, the weeks go by, about the structure we have in place at Brisbane South PHN for our lived experience advisory group. And kind of celebrate it, I guess, if that's of interest, because I know all our PHNs are at different stages. And we had a really good, what I consider a great, pull out the little party poppers moment 2 weeks ago, where we have a lived experience advisory group, so which is currently 6 amazing people. But what's really good at Brisbane South PHN is it really sits at the strategic level, and we have a couple of task forces that sit underneath. I'll share a screen quickly because I'm a really visual person. This hasn't been technical; it's still under draft.
But that's the advice from Louise Burns' research. One of the key things to do is commitment and culture at the executive level.
Yes, hang on, I lost my share screen thingy. Oh, there it is. Sorry, everyone. Nothing worse, is it? Now it's got to work. Here we go. Can you see that okay?
Can you make it any bigger?
I can try.
You can try.
How's that? Is that bigger or not?
It's a bit bigger.
Only a bit.
Right. I mean, I'm not sure about other people's eyes, so that's a lot better.
All right.
Yeah.
So at the top, the joint governance group, see the top left corner. So between, as I've mentioned before in my role here at the PHN, I'm actually a Metro South, so a Queensland Health employee. So I work for what we call the HHS here, or local health networks in other states. So I work for addiction and mental health services of our Brisbane South Queensland Health area, of which there are 4 or 5 big hospitals, 3 of which have mental health wards and services in them. Between the Addiction and Mental Health Service and Brisbane South PHN, executives from a number of the different areas, such as the AOD services area, clinical governance, they're in the joint governance group in that top left corner, as well as 3 executive members from Brisbane South PHN. So if you look to the right now, the Lived Experience Advisory Group, that's where our Lived Experience Advisory Group sits, at that same strategic level. And 2 weeks ago, we had our very first meeting of the Joint Governance Group on the left and the Lived Experience Advisory Group on the right. So everyone was in the same room, virtually though, which is actually quite good because it removes that hierarchy, as we all know. And it just went really, really well. We talked about, they started, the conversations were around, some of those really big picture strategies that are important for our public health service, for the HHS, but also for the PHN and commissioned service providers. So I just wanted to celebrate that, but also just share this structure because I think it's great. Yeah, I think we all know too well about having, one person in the room. In this case, it wasn't that. And I'll just note too that below that Lived Experience Advisory Group, we also have an AOD task force and a suicide prevention lived experience task force. So they are separate lived experience advisory groups that are obviously very topic specific and experience specific, and they also work in with the advisory group, which then talks back to the joint governance group. So anyway, lots to digest there.
Awesome.
Yeah, but I just wanted to celebrate it and share it. If
Great.
anyone's interested in how we kind of got to where we are, and the next bit's obviously to keep it going. But yeah, I'm happy to share anything with anyone along the way.
Well, Guy, working with Brisbane South for a lot of years, and that's amazing, to get it to that point, and that's what we're wanting, and and if are you able to send through that slide or
not yet? I will be able
to
soon though. Yeah, and there was a lot of other detail there that is probably more specific to how Brisbane South PHN has worked out. It's got a very place-based approach. So those chapters and all the other coloured squares below were
Mhm.
all about these sub-regional groups, we call them here, of service providers, community members. I think some of the local emergency services are part of those local subgroups as well, because along with all our regions, Brisbane South is really quite diverse. So we go down to Beaudesert, which I know some of you may know is, really quite different. Michelle on the Gold Coast there, you'll understand that too about Beaudesert's sort of inland from the Gold Coast, but very far south from Brisbane, and has very specific needs as well. So that's what the sub-regional groups were all about.
Guy, are you on the project steering group for the governance project by any chance?
I might be. I don't know.
No, I know
sometimes.
you're on one of them, but
Yes.
but anyway, that would be of real interest to the governance project. And what?
Will you point me to wherever you think it's of interest?
Yeah,
and
good.
I'll help out.
And congratulations, that's great. That's really
thank
great.
you. Yeah, I think it's, as I mentioned, it's a good little party popper moment, I think.
Yep.
And on that note, I will have to go to another meeting at 12, but I don't want to hog the floor. So please, anyone else, or if you've got any questions, please say hello.
Get in touch. Yep. Thanks, Guy.
That's
My
all right.
question is, if I happen to take a sneaky screenshot of that presentation, should I hold on to it rather than share it with my team?
Sure. Yeah. Sure,
Pop it back
Tim.
up
Yeah,
again then quickly.
You know the score though.
Yeah.
Look, Tim, I can email it to you if you like. I can. Yeah, it's just the point.
No,
because it will be
until it's when you've got it officially, I suppose, the best time.
Yeah,
it's great.
Did you want to talk to it or anything in that upcoming? Is that what you mean, or just for your general stuff?
Well, certainly it's relevant to what we're doing PHN wise.
Yeah, it is.
In terms of engagement, it's really so.
Yeah,
if you are able to send something, I might be able to put it better onto a slide. Anyway, it might be too early for that. Don't worry.
It is a bit early, only because there's some certain other chapters that aren't related to this, because what I was talking about is locked in, and this diagram is already on some of the plans and other documents. But happy to, Tim. Yeah, happy to.
And that's what we're needing to see is, good solid governance structures before, like right at the very beginning, not it's all underway and, hey, let's set up a governance structure and invite some people with a lived experience. You know what I mean?
Yeah.
So,
no, this has been, and it is called that, as you saw at the top, the governance and implementation framework, but it has been, very well planned for 2 years now. So we started implementing it a year ago. So it was almost a year to the day that we had that big first meeting between the Joint Governance Group and our Lived Experience Advisory Group, which was good.
Yeah. Hey, Lauren, that'd
but
be
I'll let you know, Tim.
Lauren, that'd be something good for you when you're doing your presentation. Yes, that fits nicely. As an example. Yeah, you're on mute, but yeah.
Yeah, perfectly. I was madly typing and admit to taking a sneaky screenshot as well. To be deleted, of course.
Yeah.
All right, I'll tell you what, I'm just going to accidentally share for a sec. If you will accidentally do a screenshot. Oh, whoops, hang on. I've just shared my screen. I'm just going to unshare.
We'll have it recorded.
Yeah. Obviously now. Thanks for that. Yep. All right.
Good on you, Guy. And if anyone else has got, we've got a governance structure, but I want to get in and change it all now after seeing that. It'd be interesting to see other PHNs and if they've got any sort of governance type structures, because it'd be really useful for the governance project. So and for other PHNs that are trying to build that business case, to Anyway, Liam, what's happening up your way?
Hey, yes. So pretty much we're planning to recommission or at least revisit the way we've commissioned some of the streams within our step care model. I'm sponsoring the project officer who's leading this. I'm hopefully going to influence it a bit. But the next step is really about that project officer writing an options paper to go to the executive level for decision. And you know, some of the options are, I guess, to do a full co-design piece, which sounds awesome. Another might just be like a limited consultation sort of thing. And I'm really just weighing up, you know, pros and cons of those options. So I guess this is maybe a call out if anyone is able to share any engagement plans or co-design project plans, or even like any recommendations papers or something you've put forward to negotiate and advocate for to undergo proper full co-design. I think for me particularly, well considered like risks and risk management or risk mitigation strategies to alleviate any of that perceived risk from an executive level, to say like, yes, I've considered it and this is our answer to that. Although, you know, my gut instinct is to, of course, let's go full co-design, but there are considerations with that. So yeah, really just a shout out. If anyone's got anything, please send it through to me. It will help a lot.
Yep. With the Yale group, we did Kerry and I did a presentation last week around community engagement and mapping. That might be useful. And also, Liam, if you go to that MHLEEN link that I popped in the chat earlier, most of the like key foundation documents, you know, around that, you know, like the safety and quality guidelines stuff. I don't know if I've put Kath Roper's co-production one up there or not, but that's a good go-to. And Indigo Daya's participation ladder is another good one. And yeah, off the top of my head, but yeah. And so if anyone does have anything to share with Liam, please share with all, you know, so if you send it through, even if you send it through and we, you know, we'll distribute it, the secretariat can send it around. And if, you know, if it's okay, copyright wise, we can pop it onto our website. So that's awesome, Liam.
Awesome. Thank you all. And I'll keep you updated with how this progresses.
Yep. Just trying to get my little congrats and celebrate. Marie. Oh, I'm coming to that. Pain management echo. Did you want to talk to that, Marie?
Probably not just because of time, but happy to send out any information through you, Paula, in regards to it, because again, it did fit with what we were talking about with under A&OD, and yes, the very real issues around pain management and reducing dependency on prescription medication.
Oh, okay. So that's something for Tim perhaps as well. It was, yeah, great. Thanks, Marie. And if you can send anything through, we can include it in the minutes. Vicky's saying, congratulations, Guy. Guy looks great. Well done, Guy. I got to cross that Brisbane River and go and hang with him, I think. All right, I'm just going through. Love to talk governance with others. Lauren, okay, yep. Sorry, okay. Oh, gosh. Wilhelmina.
Oh, I'm not been involved in it, but I was excited to see that the Community Mental Health Drug and Alcohol Research Network, which is made up of like MHCC and NADA, have just released a co-production Kickstarter, which is all about engaging with lived experience research. So it's definitely something that I know I need to take a look at and see if there's anything I can learn from that.
Yeah. And I think that's that when we send out the minutes, I think we've got that in our updates, but yeah, I spotted that one too. So good stuff. Thanks for sharing that. Oh, there's the link. Tim Heffernan. Oh, Tim's. So these are just some good co-production resources you popped in there, Tim. Yeah. Thanks for that.
That's just the one you were talking about from Kath and
Kath Roper. Yeah. That's my go-to. Great. Okay, so moving on, annual forum. So Hannah Harbison, I hope I said that right, sends her apologies, but she's been working closely with Maddie along with the working group. So Maddie, would you be able to give us a bit of an update around discussion decisions and where to from here? And please jump in, anyone involved in the working group. I know I was at the last meeting, but yeah. Say no more.
Oh, good. Well, thank you. So far, the working group has met twice, and we have reached a couple of decisions. So we've decided that it will be a 2-day forum and have set the date, which will be Wednesday the 1st and Thursday the 2nd of June. It's going to be held in Canberra. We've currently reached out to a venue and we're just waiting for them to send us back a cost proposal. And we should have that by the end of the week. The working group are also currently deciding on the overarching theme for the forum. However, it looks like day 1 is likely to explore like lived experience environment, including the various reforms, the national guidelines, things like that. And day 2 will be more geared towards PHNs and showcasing their lived experience engagement, similar to what we did last year with various case studies being presented, things like that. We've also drafted a program, just kind of with start, finish times, and then the time slots for our keynote speakers and other presentations as well. So I'll be able to share that with you in a moment.
Oh, I was going to try.
Oh, you can share it if you want, Paula.
I'll try while you're talking, but
yeah.
good luck with it.
So we were originally thinking about going with a breakout room and running concurrent sessions. However, we've just decided to keep it as the one room and then incorporate panel discussion so we can kind of hear from a few different people at the one time. Then we're going to start looking at inviting speakers. So when we bring up the program, we're open to suggestions on who we should invite to speak and present at the forum, and then also open to suggestions like a general invitation list as well. So we're, it's going to be MHLEEN, some lead people and a few others. So if there's anyone you can think of that you think should be invited, feel free to send that through. So Paula, I can't see, hold on. Have you started
has it come up?
The program? Let me check.
I tried. Can you see it or?
Yeah. Can you just scroll? Yeah, that's great. Thank you. So day 1 will be a 9 to 5 day. So you can see the kind of time slots there. We'll obviously start with our welcome to country. Hannah Harbison has flagged that we're going to aim to do a welcome to country for both days. She said that she's organised national conferences previously and that was appropriate. So we're going to look if we can do that. We've put in their ministerial address or having a minister come and speak. So we're just going to reach out, I think Paula mentioned, to Greg Hunt.
Yeah, that was one thing.
We're just going to see, yeah.
Yeah, he's retiring, so we might just rethink that one. But we'll do a reach out to Christine Morgan. At least she attended last time.
Yeah.
Maddie, do you mind if I just say, so this program kind of changed a little bit from the discussions, when was it, earlier this week? And where we've got things like these concurrent sessions, these are going to be more discussion topics. So there'll be, opportunity at tables to, have some conversations, because that was some of the feedback from the last one is, we don't want just a whole heap of people speaking at us, even if they are lived experience. Some, wanting opportunities for some of those discussions. So that's, sorry, Maddie, but
yeah, wasn't at that meeting.
Yeah, you weren't. So
technical difficulties. So
yeah, jump in anyone from the working group if I'm. Do you want to go to day 2?
Just go back up just to day one. So the last session there, 4 to 5 p.m, we're putting in a networking event. So that will just be an opportunity for people to talk to each other a bit more informally. It's just going to be like a cocktail style with finger food, cash bar, stuff like that. It'll probably be held in a separate room to where the main forum is, just so we're kind of moving into a different environment, different vibe. And then if you want to just go to day 2, Paula.
Yep.
Day 2 will be a shorter day. So we're going to start at 9:30 and then hopefully finish up at 2:45. And again, those concurrent sessions, we're going to take those out and then replace them with discussion topics. So a bit of a shorter day, and probably a bit more of a relaxed, not as information heavy day as day 1. Something else that Hannah Harbinson has flagged to add in is a relaxation room. So we're in discussions with the venue at the moment about just securing like a smaller room where you know, anyone, including our lived experience reps, can kind of go in there, hoping to have like a peer support worker or something hanging out. And if, you know, what's up, Paula?
I don't know what I did just then. Sorry.
I think you're just scrolling around.
Oh, was I?
Document. There's nothing else in there apart from the draft program. That's basically, I've just grabbed the same program we used last year and then just made some tweaks to it. So yeah, we'll need to clean it up a little bit before it's finalized, but you're still sharing the forum contact details page.
I don't know where it's gone. Right. What's that?
Do you want to stop sharing?
I don't know how.
Oh,
I can't see it anywhere.
The screen is frozen. I don't know.
Oh, hang on. There we go. Did that stop?
Okay, yeah, that's great. Thanks, Paul. I can share it again. I have it in front of me. But I don't know if anyone from the working group wants to jump in and just talk about maybe the meeting we had the other day that I unfortunately wasn't there for. Any other comments?
Yeah, look, Hannah's obviously got a lot of experience in this space, and I feel very confident with how you two will work together with our little team, Patty. I think it's just about populating that with speakers, etc.
Yeah.
But it is the thing is, you know, normally these sorts of conferences do take a lot longer. We're trying to set records all over.
Yeah.
But it's a lot of work, and I think, yeah, it'll be
a lot of
good
behind it. Yeah.
People support it with ideas and names.
Yep.
And
Yep. Thanks, Tim. Linda, did you want to say anything or? Oh,
today. Can you
no
hear
worries.
Me?
Yeah.
No, it's okay. So I'd like to make one thing. Can you hear me?
I can now.
You can now. I'll just come in really close. 2 points. One thing I flagged with you, Paula, was the very good presentation from the UK about lived experience leadership and some of the issues that they're discovering. I thought that was a very helpful video. Tim, this was something that was linked by the Alive Center to all of us to have a look at. And I just found it very clear and something that was a really good discussion starter. The other thing I'd like to say is maybe there's room in the forum within one of the panels to really look at our working relationship with the state. This is where in Victoria we've got quite a bit of activity. I'm sorry I wasn't here for the individual PHN updates, but this is really where our activity is very much concentrated, is working with our Victorian PHNs and the state, the new lived experience branch, which is part of the Victorian Department of Health, Mental Health and Wellbeing Division. So I feel that if we can concentrate somewhere within the forum on what are we learning about our working relationship with the state, This will flow on from bilateral agreements that are happening now in the national agreement, and also other reforms happening in individual states. For us, Royal Commission recommendations. For you in Queensland, you've got your own inquiry happening. I just feel it's a very important area to touch upon in the forum and share.
Thanks for that, Linda. So probably the most pressing stuff, and I do want to firstly acknowledge all of the behind the scenes stuff that's going on, you know, putting, you know, go Maddie, you rock, and so does Hannah. But in terms of the broader MHLEEN, and the working group, sorry, but in terms of today, there's a couple of key, you know, things we need to have a discussion about. So the first one is nominations from our lead team and or others. So and the budget around getting lead advisory group members, and or if you haven't got those other lived experience leaders to come along to that. I think budget wise, we've currently got 50 people on our lead register. It's going to be a bit of a stretch, and also we need to look at some of those lead members where we've got some PHNs have got 4 or 5 on there and those sorts of things. So I'm rambling, but cut a long story short.
I think in our
Go, Maddie.
In our budget, when we kind of wrote up our work plan and our budget that we submitted to the department at the start of the financial year, this financial year, we budgeted in there for the forum to cover 1 lived experience rep per PHN, so that would be a total of 31. We do need to revisit the budget because we've got a few underspends across other activities and things like that. So we should have a little bit more money to use. But I think what Paul is trying to say is that we'd like to see PHNs also then sponsoring potentially an additional lived experience rep to attend.
And we can support that by sending some correspondence to CEOs requesting, or, you know, inviting and encouraging that support. And I guess just the other options is maybe and again, looking at the budget, maybe we could look at something, you know, for that second person where like MHLEEN could cover the accommodation, but the PHN perhaps could cover the other associated travel accommodation costs. So I guess, but Maddie, you please talk about this. And
no, that's okay. We'll have a better idea on that process kind of once we get the proposal back from the venue, because they're going to provide us with some accommodation costing, things like that. And then we can kind of compare that to our budget and then give a bit of a better idea on costing per PHN if they were to nominate an additional lived experience person and then pay for that sponsorship. And then I guess we also wanted to check in. I think I raised it in the working group, but the process last year for nominating lead people, we did that you would go and find or nominate the lived experience person, pay for their accommodation and flights, etc., and then invoice us and would reimburse your PHN with the MHLEEN budget. So I just wanted to check if that process last year worked well, or if there's any feedback on how to make it a bit more streamlined this time around. Just because we want to start getting people nominated and booked in as soon as possible. So
yeah, we'll literally be
close to the time because it's only 2 months away.
Yeah, we'll literally be sending out date claimers today. I'll be drafting up some CEO correspondence from Libby to all PHNs, outlining, you know, what we're after. And then I guess the what we need from you is nominations. Is that what we need, Maddie?
Yeah, we'll need, you know, who we want to nominate. So that, I guess that's another question, is we already have our lived experience advocacy delegates, our lead group. So I guess we can send out that membership and then potentially can choose which lead rep you want to send, because I know that some PHNs have up to 4 people sitting on that group. So yeah, it's just figuring out that.
Okay, so Michelle's saying good process last time, Maddie. PHN pay and invoice Brisbane. Yep. Tim tried to follow with consider. Yeah. So yep. So Maddie. So that's so next steps are we will draft correspondence to the CEOs, confirm the venue and details, and put a bit of flesh around the program to send out, and 3, send out the EOI nomination process for lived experience reps for individual PHNs to nominate.
Yep.
So I'm glad we recorded that because I won't remember it. All righty. I'm just conscious of time, and I'm just wondering whether we need to have any more discussion about the annual forum. Any, it's not a speak now, forever hold your peace, but I think the working group are chipping away at it. We've had one go at it last year. We've had lots of learnings, so we're trying to incorporate those learnings for this time. We've got a little bit longer lead time, not much. Probably just the other thing, the most important thing is that we'll probably organise people. Most people will fly in the night before, and we'll have an informal catch up, get to know each other. So it's not walking in cold the next day. And I know that we had lots of fun at our last one. Well, at least I did. So that's it. All righty. Okay, so moving on. So our leadership projects. Kerry, I just thought and anyone on the project steering group. You there? You still with us, Kerry? Doesn't look like it. Okay, so I'm going to have to wing it a bit because I think I've missed a few of the meetings. So please, anyone on the steering group, if you can add to them, please let me know. So project 1, that's the Clearinghouse website one. I think we're at a point where there's the I don't even know how to use the technology, but what the website's kind of going to look like, what the sections are, that a leader's pulled together a heap of existing leadership resources, and I think there's a meeting coming up just to check on the visuals and the drop downs and those sorts of things. And I'm just looking at who else is on it to help me out here. Tim? Maddie?
Yeah. No,
Tim, you're the only one on there, yeah?
We've got another meeting coming up shortly, haven't we?
Yeah, I think so.
Right. I've missed a bit of it as well.
Vicky, have you managed it? Yeah, that's my understanding. Vicky, does that sound right to you?
Sorry, Paula, what was that?
The Clearinghouse project with a leader, the website project.
Yes.
Leader, yeah.
Sorry.
I've been on it.
Oh, Lauren, yeah. So does that sound? Does that sound about where it's at, Lauren?
Yeah, just kind of finalising, the website and the categories. There was lots of discussion about how to be inclusive in terms of how you present and navigate all the various things. But yeah, it's definitely got form, and we've had some amazing conversations about, lived experience more generally.
Great, thanks. And then the other 2 projects, they're our project consultants as Leland down in South Australia, who are the gurus in this space and leading the way. Again, my memory and understanding is, so we've got project plans for both of them outlining what's going to be achieved and when. Leland, I think they've sent me, and I don't know if they've sent it to the project steering group, some tentative dates to engage with the lead group in terms of some of the co-design of these two projects. Now, again, I'm struggling and looking who else's names are on these groups. Liam, you're on governance. Have you? Sorry, I'm putting people on the spot now.
Oh, I had a feeling it was coming. I don't know why. I could sense it.
I should have sent a pre-meeting email, but
for that group, I think there was an acknowledgement that we're building on existing work. So there's, we're not developing a governance framework or anything. There's the National Peer Workforce Development Guidelines and Safety and Quality Engagement Guidelines, things like that. So Leleen has put together a project plan about how to develop like a toolkit to when best to access those existing frameworks and guidelines, and then how to use them. So it's more of like I can't think of a better word for it than a toolkit or whatever to then get into those things. And they've submitted that project plan with a fantastic vision and objectives, and with the intention of co-designing how we will actually go about that as well. So off the top of my head, that's about as much as I can come up with.
Oh, that's brilliant. And then the lived experience training project steering group. And again, I sat in for a little bit of one and can't trust my memory, but I know that there's been a few of us that have just been sending through all the stuff. So, even the work that MHLEEN did, for those of you that were involved when COVID first hit, and we did took some time to do some research around like all available online capacity building training. So we already had a whole pieces of work, but we didn't have anywhere to put it. So we've handed over a lot of some of the work that we've done as MHLEEN, like with our updates and all of those sorts of things. So they're sitting on a whole bunch of stuff with that. And that's about all I can say. And I think I think they're getting into the writing up phase, I think, but I apologize. I was hoping Kerry was here so I could throw her in the deep end, but we're happy and confident that they're progressing along. And I also think that these three projects will want to incorporate somehow into the annual forum, because they'll be almost at a point of pre-launching. So it'd be great to see what and how our investment in and partnering with the National Mental Health Forum to undertake these projects. Okie dokie. 4 minutes. 4 minutes left. Next meeting, April 28th. Next working group meeting, Maddie, will be happening with the forum. Do we know?
Did you set a date in the last meeting when I wasn't there? No? Okay. Hopefully soon.
Yeah. Sorry.
I think Linda has a hand
Maddie's going on leave next week. What am I going to do? Oh, anyway. Well, look, 3 minutes early.
Linda has a hand up.
Oh, sorry. Sorry, Linda.
I'm sorry, Paula and everyone. I just have a very quick question before we finish up today. Eastern Melbourne PHN has been doing a Lunch and Learn series on lived experience, which we will continue in the month of May. And I'd like to ask everyone whether they know of very good video resources on lived experience. And I believe the Mental Health Coordinating Council had done some short videos at one point introducing lived experience. But does anybody else know of any other video resources that you'd recommend for staff who are just coming new to an understanding of lived experience? And we just want that kind of visuals to break up the PowerPoint talking heads, all of that. Does anybody know of any other very effective materials that have been produced along those lines? And it was the coordinating council, wasn't it, that did the lived experience series a while back? Does anyone remember? I can certainly link it up.
Yeah. Tim?
Yeah.
The peer work hub with the mental health.
Yes.
That's it.
Has a series
That's
of
where
videos on peer work mainly, rather than broader lived experience, Linda. I'll have a think about broader lived experience. I'm not sure, but there's are quite good little videos.
The peer work hub. I know I'd seen them and I thought they were very effective. Yeah. Thank you, Tim.
Yeah. Louise Burns has got some good short and sweet ones on the Queensland Mental Health Commission's website, and I'd maybe also take a look at National Mental Health Consumer Carer Forum maybe, and Lived Experience Australia maybe.
Yeah, I was just wondering if anybody knew offhand just a really good one, you know, that they would recommend. But I will certainly look at the websites again, and Louise Burns' own research website. I'll have a look there.
Yeah, I'll take a look, Linda, and flick through. When do you need it by?
Oh, look, this is
Yesterday?
for no. This is for sometime in May. I mean, it could help all of us. Actually, to have that.
Yeah. So I can't remember if we've popped anything on the MHLEEN website, or there might be some stuff on the PIMS link. Yep, I just can't remember off the top of my head, but yeah, anything we find that's good like that, we can pop onto there so people can use it. Yeah.
And I've just put in the chat YouTube. It's that everyone's probably seen it. It's that blobs and squares sort of concept. It's a bit of fun. It's not the best, but it's pretty good introduction to the value of co-production and what that actually means. If that's sort of a topic that you're covering.
Yeah. The one Robin Priest showed at the last annual forum was kind of cool for was that being a penguin and not a something? That was actually quite clever in terms of sort of coming in, working within an organization that's, I can't remember what the two birds were, but there was a penguin and then a group of other, I'm not making it, you can tell I'm getting tired, I'm not making sense, but that's quite a clever one. That's in the link to that should be in our last annual report, Linda. Yeah. Okay. Yeah, roses in the ocean. That's a good idea, Vicky. Yeah. Oh, look, thanks everyone. All right. Well, thank you again for your time today. Great discussion. We're chugging along. We got lots to do. Thanks, Karina, and can you thank Caitlin too? It was really useful, good to hear and have hear that firsthand. And Carrie too. Thank you, Carrie, for and the commission for keeping us in the loop, and Vicky from Black Dog. Always awesome having Vicky around, and everyone else who's here. We rock. Okay, so have a great rest of the day, and get in touch if you need to. Okay, see ya. Bye.
Yeah.
Bye. Thanks, Paula. Thanks, Maddie.
Thanks, everyone. Bye.
Thanks,
Bye.
Bye. Thanks, everyone.